Hi, my name is Brent Marinelli, and today we're going to be talking about the progress report on the Baptist Health Emergency Room and the related opioid research. The purpose of this report is to examine the Baptist Health Emergency Department physicians' opioid prescribing statistics, compare them to national averages and standards, and recommend actions based on the findings. The audience for this report will be administrators at Baptist Health Paducah and especially William A. Brown. Mr. Brown is the president of Baptist Health Paducah and regional director of the Baptist Health Western Region. We really wanted to target the administrators and Mr. Brown because we believe they can make the quickest and most effective impact on the opioid epidemic here in the region. So a little bit about this presentation is we're going to be focusing on the completed task and future tasks, such as background, interviews, and editing, and making sure it's finished on time. So to better understand the opioid epidemic, we had to do a little bit of research. We did the research on 3 different stages, from a national basis, a local and regional basis, and also here at Baptist Health Paducah. For the national basis, we got an idea of what the epidemic was like in the United States from the Center for Disease Control and Prevention and also the National Institute of Drug Addiction. We also looked into a little bit more, such as newspapers and journals that had their own private research and private information that we used to supplement our research. As for the local and regional basis, we studied things such as Four Rivers Behavioral Health here in Paducah. Four Rivers is an overdose and addiction institute that deals with that kind of stuff in the tri-state region. CDC also has published information relating to the area and the state. And whenever we studied the Baptist Health Paducah, we wanted to look at the protocol, procedures, and any information they may have relating to opioids. In all of that research, we found some pretty interesting things. One of the most interesting of those was that McCracken County, where Baptist Health Paducah resides, is in the top tier of prescribers. What this means is that physicians and providers in this region are prescribing more opioids than just about anywhere in the United States. This region prescribes anywhere from 959 to 5,542 milligrams of morphine equivalent per person. That's per the CDC Vital Signs report. We're also seeing a rise in number of overdose patients at that Four Rivers Behavioral Health that I just talked about. And we are actually, in fact, requesting information from Four Rivers about that. We have published or sent in a media request form. Not sure if we're going to get anything back on time. We're also seeing a growing rate of arrest made by local law enforcement relating to opioids and heroin, but we're really just going to focus on opioids for the purpose of this report. Whenever we collected data, we observed 6 different providers. We observed 3 doctors, 2 nurse practitioners, and 1 physician's assistant. In all the data we collected, we looked at things such as the total number of patients seen, total number of patients prescribed an opioid, total amount of pills prescribed, and the total milligram quantity of opioids prescribed. We did this between July 16th and 22nd on 5 different occasions. Every research was done between noon and midnight, and that's because that's when the most providers are available. Every provider, no matter how long they were there, did have a report on the number of opioids they did prescribe. And here is a quick brief chart about who we studied and when we studied them. We kept the identity of all of these safe because that was upon their request. Each provider asked that any information we provided about them did remain in private for the purpose of this report. So we also interviewed each of the providers. We asked them 6 different questions ranging anywhere from what is their opinion on the opioid epidemic, what can be done better, and what do they think about their own opioid prescribing process. Each provider's statement was generalized per question and then summarized as a whole. Some of the findings we found through not only the data but the interviews was pretty interesting. Here at Baptist Health Paducah Emergency Department, providers exceed the national average in percentage of patients prescribing opioids and exceed in the average amount of milligrams of morphine equivalent per person. And that's directly tied back to that research we found per the CDC. So there is some facts relating to CDC about that. Those interviews that we did really showed where we can improve here at Baptist Health Paducah, such as continuing education and an oversight board that we may need to implement. So this is a quick average of what we are looking at here at Baptist Health. Within the report, it goes into a little bit more detail, but overall, out of the 843 patients that the provider saw in this time frame, 38% of them were prescribed opioids. That's compared to 24% on a national average in the emergency room that are prescribed opioids. So Baptist Health Paducah is well above the average, and it really shows that actions probably need to be taken here in the region. So this report is a work in progress. We are still working on editing, proofreading, and tweaking. There is still some information missing, such as that Four Rivers Behavioral Health report that we talked about. That's really going to help in the recommendation part and some more data that we can get from them. Within this report, we did cite the CDC that was relating to that morphine milligrams equivalent. Overall, this report, we're expecting it in on time. There's a few things that we are still missing, hoping to get in by the 2nd when this is due. Overall, it's shaping up to be a nice report and should be looking good. Thank you.